A top cardiologist has coined the phrase the menopause jaw, one of the many hidden symptoms of serious heart disease in women. We'll deep dive into other bizarre signs you should be on the lookout for because Bloom Health Club starts right now.
From the Stream Center, welcome to Bloom Health Club, sponsored by Monticciolo Family and Sedation Dentistry.
For gender-specific medicine in this country, especially when it comes to heart disease. And leading the charge is our Bloom Health Club guest, cardiologist, Dr. Jayne Morgan. Dr. Morgan, thank you so much for being the newest member of Bloom Health Club.
Thank you. I appreciate being a member now today. I think that's excellent.
So listen, I think it's so incredible that you are out doing all these speaking engagements. I know you were at a big menopause convention in Orlando not long ago. It's so important that women understand that we don't have the same makeup as men, and the healthcare system is set up to support men and how disease affects them, but not women.
You know what? That is so true. I call it the big extrapolation. We get data on our research, and by research, I mean men, and we take that data to the FDA to get it approved. The data is approved, so we get all these new drugs and all these new devices, but we really only have data on men. We just extrapolate it to everyone else. It's called just the big extrapolation is what I call it. And that's how we literally practice medicine in this country, that we have data on a very narrow demographic, and we just assume, it's good for everybody. And it really isn't. And we've really been doing harm to women.
Yeah. And, you know, a lot of our focus, and I would love to introduce our producer, Lily Oberhelman, who's directing behind the scenes today. Lily, thanks so much for being with us. We do like to educate women on our globally syndicated health and wellness show, Bloom, and here on Bloom Health Club, that, you know, the healthcare system is really failing women right now because of what you just said.
That's right.
The studies are all about men and not for women. And so we love it when a guest like you will come on, you know, a cardiologist like yourself and share the why behind the messaging that we try to push out.
And, you know, it's not that the healthcare system is failing us now. It's always failed us, but we've just accepted it. The culture here in the U.S. is for women to sort of take care of other people, put your own needs last. And not only does the culture expect it of us, we expect it of ourselves. We also put ourselves last. It's what we expect. And so the healthcare system is sort of a reflection of this culture that we grow up in, where we are not a priority. And we also don't prioritize ourselves. And that's the message that has to change. There needs to be gender specificity because women are different from men pathophysiologically, hormonally. There are some things that are similar, but we are different. And we have to stop having the health of women only being reduced to reproduction. It's not just all about breast, vagina, pelvis. Guess what? We've got a heart. We've got brain, we have liver, we have intestines, we have bones, we have all the other organs. Well, for some reason, when we go in for our physical exam, we get, mammograms and pap smears, and out the door we go, as if we actually have no other organs. And so that's the part that has to change. Women's health is just not about reproduction. We're not just reproductive vessels. There are other things, and it's heart disease that's actually the number one killer of women. There's another organ that is actually killing women, and it has nothing to do with our reproduction.
Yeah, and women do not realize that. You said there was a poll out there, and when women were asked, what do you think the number one killer is? Most women said breast cancer, and I'm
That's
so
true.
grateful. I'm the daughter of a breast cancer survivor. My late mom battled it. It's important that we know about this, but nobody's talking about the heart, especially when it comes to hidden causes and symptoms that you point out. Like we kicked off Bloom Health Club today saying that a pain in your jaw could be directly linked to heart health if you're a woman.
Isn't that amazing?
Yeah.
Jaw pain. Because when we talk about cardiac symptoms, most people think about chest pain, chest pressure, shortness of breath, maybe pain in your left arm. But it turns out that women oftentimes don't experience chest pain or cardiac or heart attack symptoms in that way. We may just have fatigue, just be a little tired, can't seem to get over it. Flu-like symptoms that we just can't shake, nausea. any number of reasons that you may have nausea. You may take something and go and lie down, but actually you're having a heart attack, right arm pain, and then, of course, jaw pain. And who's going to see those patients with jaw pains? More often than not, it will be the dentist. The woman will make an appointment with her dentist and go in to have an oral exam. And if you're a dentist listening and you've got a midlife woman in front of you who has come in complaining of pain in her lower jaw, and you've done your oral exam and find no reason for the pain, the next step is not reassurance. The next step is to send that woman to the emergency room or call her physician immediately so she can get an EKG. So we're depending on the dentist now to lean in so that we can start to dial back this heart disease as the number one killer of women. And when these women are seen in the dentist's office, that's an opportunity for the dentist to connect with the other part of the health system and make certain that that woman is not discharged out, that there's actually another step that the dentist needs to take to send her back into the health system.
Yeah, and I know you're on a speaking circuit right now, and I think it's so interesting that you are communicating with the dental world, because at the end of the day, you know, we have heard things like gingivitis or bacteria buildup or plaque on your teeth seeps into your blood system and can cause major health issues, including, you know, health issues with your heart. But never before have I heard that the aching jaw that most women would put on the back burner.
Completely on the back burner.
Right.
We are the leaders of back burners, especially if it has to do with our own health. We put it on the back burner. We wait. It can wait. Our children go, you know, to all their pediatrician's appointments. We support our husbands and our spouses to move forward. But when something happens to us, we can sort of tough it out. We take aspirin. We maybe rest. Maybe we don't rest. We have to keep going. The next person needs X. The next person needs Y. And that's the reason why the first heart attack of a woman is more often fatal than the first heart attack of a man, because of that delay. The average delay is 37 minutes for a woman to get into the cath lab and get her arteries open. And when we say 37 minutes, that may sound like a small amount of time, but every 5-minute delay increases your risk of death. And when we also say 37 minutes, there are those people on the other end of the spectrum, this is an average, who are waiting days. Not because they're not serious about their health, but they don't recognize that what's happening to them could be a heart attack. They literally just don't recognize it. And it's not their fault. Doctors don't recognize it either. People listening right now, you probably now have learned more than your doctor knows about menopause and the jaw. It's simply not taught. I was not taught in medical school. I was not taught during my residency nor during my fellowship. And so it's not only women advocating for ourselves, the health system needs to catch up.
Yeah, without
well.
a doubt. And another big reason that the healthcare system has fallen back when it comes to women was what many call a flawed women's health initiative. Now, you say there were some good parts of that, but there was a major stumbling block when all hormone replacement therapy was taken out of the equation.
Right.
And women were just saying, yeah, a hot flash is just a hot flash, but that's not the case.
That's not the case. And the Women's Health Initiative, certainly there were, you know, it wasn't all bad. So I want to be clear about that. But it was certainly overstated. The results were overstated. It was prematurely discontinued. And then the aftermath was just a complete bomb explosion. And what that meant was hormones disappeared for women overnight. But the other tragedy of that, the travesty, is that training for physicians also disappeared. So you've got an entire generation of physicians who've never even heard the word menopause during your entire training or medical school. Never. It just disappeared overnight. Women just fell off the healthcare trajectory. Never trained on them again. And when we did a recent survey and looked at primary care physicians and cardiologists, only 20% of primary care physicians admitted that they felt some level of comfort in treating a woman with cardiac symptoms. What's interesting is that when we polled cardiologists, only 40% of them felt comfortable. Literally, this is what we do. This is our job to take care of hearts. Only 40% felt comfortable treating women. And when you think about that, it makes sense because most cardiologists are men. And then you couple that with the results of the Women's Health Initiative, and we stopped getting any training. And so it's a wonder even that 40% have any comfort. And when we add menopause to that, which we did not in that survey, I wonder that number probably drops down into the single digits because literally no one knows.
Wow.
Yeah.
Did you have a question, Lily?
I did. So to correct me if I'm wrong, but from what I've heard, chronic stress plays a huge role in developing heart disease in any way, shape, or form. Does chronic stress affect men and women differently? And then my follow-up is, I know a lot of people have panic attacks. How can you just distinguish having a panic attack from actually needing to go to the emergency room and having a full-blown heart attack? Because they're very hard to tell in the moment between the two.
No, those are great questions. And part of what I think about when I think about panic attacks is that they are overly indexed in women. It's just sort of a diagnosis that men almost never get at the hospital. And in fact, one of the, and not to minimize people who are actually having heart attacks, but I want to get to the question of this mix-up. Because when women are at midlife and you're coming to the emergency room with these symptoms that we call atypical symptoms of chest pain, which really irritates me because women are the majority of the population. We're more than 51% of the population. How did our symptoms get to be atypical? Why do we have the atypical symptoms? So it just goes to show you just the patriarchal hierarchy of the system. So we have these atypical symptoms. And so what happens is when you put the word atypical into a chart, it's sort of like a wink and a nod between the doctors. Nothing's really going on with her. She's probably just having a panic attack. In fact, we write atypical chest pain, rule out panic disorder. And so what do we see in women in midlife? Increased prescriptions for anxiolytics, anxiety medications, antidepressants. You know, we should be depressed and anxious. Nobody's taking care of us. So there's a reason. We actually probably should.
There's a hormonal reason, too.
There is a hormonal reason.
And that's what always makes me so angry is that women are giving prescriptions for anxiety when the anxiety is driven by the fact that their hormones are completely out of whack. And if that became imbalanced, they wouldn't need the medication for anxiety.
That's right. And when we talk about panic disorders, oftentimes those symptoms are more of what we call those classic cardiac symptoms, which may not be the symptoms of a woman. So you may have the racing heartbeat and the fluttering, and you're starting to feel anxious and sweaty. Remember, I just told you women sometimes feel tired. It's more of a slowdown. Now, it doesn't mean that we don't get these other symptoms, but when we have symptoms that are not these classic symptoms, I hate using the word classic versus atypical, then it's more often the women who have them, and then the women who will be dismissed in the emergency room. So what happens when you use terms like atypical? Words are powerful. Or you see a woman and you already have in your mind that she's having a panic attack. What happens in the emergency room? That person is triaged to a lower level of care and concern. That's how women end up dying.
And they do die in the hospital. They're far more likely. I believe this statistic is 3 times more likely to die in the hospital after being admitted with heart issues.
And more likely to die at home where they didn't receive care. So, you know, that's why heart disease is the #1 killer of women. It is the delay in care that is the fault of the healthcare system and the woman. But I really don't want to blame women because the fact of the matter is we don't teach the information. So how can women be expected to know it? The doctors don't even know it.
Right.
So, but that delay in care it makes us suffer. And that's why that heart attack is more often fatal. Those 37 minutes really are important. They really matter. And when you think just to get that average of 37 minutes, there's some women who are at home for days, just not feeling well. In fact, often when women come in finally to an emergency room or to a cardiology evaluation and get an EKG, we can often see where there's evidence of a previous heart attack. You might say, oh, Gayle, I see you've had a heart attack before. How long ago was it? And Gayle is shocked to learn that she's had a heart attack.
Really?
Yes.
man, the symptoms are very, very different. I want to go back to one that we just briefly touched on,
Right.
and that has to do with the hot flashes, because that is not just a part of menopause. That means that your hormones are shot, which is putting stress on the heart.
Yeah, I like the way you say the hormones are shot. So, during perimenopause, which can be anywhere between the ages of 35 and 58, and what perimenopause really means is it doesn't mean that you're not having menstrual cycles. It doesn't mean that you're not fertile. It doesn't mean that you're not ovulating. It means that your hormones have begun to change in a way that they are gradually decreasing. So the fun part is you can be in perimenopause, but also need birth control because you might get pregnant. So you're in both. So one of the things that I always want to make that clear to people is like, oh, I can't be in perimenopause, or people think perimenopause and menopause are the same thing. It's not. Perimenopause are the years that lead up to menopause, and menopause is when you've gone 12 consecutive months without a menstrual cycle. It has to be 12 consecutive months. So those years leading up to menopause can be 15 or 20 years, and your hormones they don't drop sort of suddenly. They kind of go up and down. They start to be chaotic and non-cyclical. And that's what gives you the symptoms. When they go up, you feel great. When they take a dive like a roller coaster, you get that flushing, and you get the sweating and the hot flashes and the night sweats. That's what those are. The reason that it is important is, we usually laugh when we see these women. We see them sweating. We turn on a fan. We fan them ourselves. But the fact of the matter is that woman's body is literally screaming to the world, look at me. My risk of heart disease is increasing. And that's because a woman's risk of a heart attack prior to perimenopause is only half that of a man's. But after menopause, it equals that of a man's. And the change during perimenopause is that loss of estrogen, which is a cardioprotectant. It protects the hearts of women. And it's also an anti-inflammatory agent. I think Lily brought up inflammation. Estrogen is our natural anti-inflammatory agent. Inflammation drives atherosclerosis, those plaques in the arteries that lead to a heart attack. So when we lose that, then our risk of heart disease increases. So these symptoms are not nothing. They're not, ha ha, look at her. These are not night sweats and, oh, I need to just, tough it out and take sleeping pills. No, you need to talk with your physician because your risk of heart disease is increasing. Your body is literally telling everybody, look at me, my risk of heart disease is increasing, and we do nothing.
And you really need to go to a doctor that's willing to cast the net wide when it comes to treatment options. I know that you don't necessarily think hormone replacement therapy is for everyone. Some doctors are turning to GLP-1 drugs, which bring down inflammation in the body. They're putting women on very, very low doses of this peptide, but consistent doses. So at the end of the day, what do women need to be asking their doctors when they go in with concerns? Because from what I'm hearing, we better be our own healthcare advocate.
You have to be your own healthcare advocate. And so there are some blood tests that you should have. You should check your thyroid hormone. You should check your vitamin D. You want to make sure your blood pressure is at goal. Blood pressure needs to be treated. Cholesterol levels, but a very specific cholesterol called LP(a) has to be checked. There's a genetic component to it. And if it's elevated, it increases your risk of heart disease. Think about things like getting a calcium score. That will give you your 10-year cardiac risk index. So these are all things that you can do. And if you're overweight, we want to talk about diet and exercise. But listen, I don't want to have midlife women concerned about their weight, because what happens also in midlife, the drop in estrogen and your drop in progesterone impacts your satiety center. So it takes more food and more calories to be full, because your ghrelin and leptin hormones that control hunger are now also out of whack. So now it takes more food for you to actually feel the sensation of being full. At the same time, your metabolism has slowed. That's how we end up putting on weight. We don't feel full like we used to. Metabolism has slowed, and we may or may not be exercising. So it's like a triple whammy coming at us.
And something else that you made me think about when we were talking about this is that and women becoming their own healthcare advocates in life is that sometimes that means going against the grain of what a trusted doctor might tell you. I waited for 8 months to get answers about my thyroid issues. My hair was falling out. I was having to drive with my head out the window. I was so exhausted all the time. And the doctor that I waited 8 months for told me I needed cognitive behavioral therapy. Well, what I ended up needing was a compounded thyroid medication and to get my hormones imbalanced. So unfortunately, because of a lack of education, women are getting gaslit when they go and share their symptoms.
Always. And it's always, not always, I don't want to say always, but often it's the emotional fallback, like your cognitive behavioral therapy, your panic disorders, your anxiety, your depression. No, it's actually something real. And I need to say goodbye to you, doctor. You've been great to me. You've been my doctor for the last 25 years. We've been through a lot together and you've been excellent. But I'm in another phase of my life now and you just can't serve me here. So you should say goodbye with a smile and move on to the doctor that you need for the next phase of your life.
Yeah, because it's not about hurting anybody's feelings. No. It's about living the rest of your life to the fullest capacity with the right health care, feeling the way that you deserve to feel. And I think a lot of women have just come to the belief system that I'm getting up there, I'm old, I'm getting heavier, I got brain fog. My big thing before I got my hormones balanced was I was dealing with major depression. I had everything to be happy for in life, but all I could do is sit in bed and wonder why I was still alive. As soon as I got my hormones fixed, that all went away. So I love what you said. It might mean a temporary breakup or a total breakup with your doctor, and you got to find
it's a permanent. You just move on. It's kind of like you outgrew your pediatrician. At some point, you just age out, and it's like it's time for me to see somebody else.
I love that.
Especially if your doctor hasn't kept up with the information. Again, I don't want to blame doctors because your doctor could be very up to date and practicing to the top of their license of what we were taught. What I'm talking to you about now, we're not taught.
All right, let's take a quick viewer question. We only have a couple minutes left, but Jessica wants to know, how does heart disease affect women differently than men?
Yeah. So when we look at heart disease, sometimes women have disease in their small vessels. We call that microvascular disease. That's much more common in women than men. The other thing that happens is that your symptoms, Jessica, can be different than a man. And so you need to make certain that you're getting things checked out. For instance, jaw pain or right arm pain instead of left arm pain, or nausea is a good one, and fatigue. These are more common symptoms that we see in women that actually can be attributed to other things. I want to be clear. Nausea and fatigue can be attributed to other things, but they're more likely to be attributed to heart disease in women who are at midlife.
All right, and then just last but not least, you kind of gave us a checklist that, talk about the EKG, get tested for that vitamin D, get your calcium score. What, real quick, what were some other ones that we need to ask for?
We want to do thyroid, we want to do magnesium levels, want to get your blood pressure, cholesterol, and cholesterol, you want to ask for that LP, little a. It's lowercase l, lowercase p, parenthesis, lowercase a, parenthesis. So we want to make certain that we're treating everything aggressively to goal. Again, have the conversation about hormones. It doesn't mean that you have to take hormone replacement therapy, but it does mean that you are intelligent enough to get all of the information and make the right decision for you. We should not have other people making your decision.
I love it. And we will end with that. Doctor, thank you so much for joining us.
Always a pleasure, Gayle.
And thank you to Monticciolo Family and Sedation Dentistry believing in us to sponsor the show so we can get this very important information to you. And you can watch our streaming show, Bloom Health Club, on Apple TV, Fire TV, Roku, Samsung TV, WFLA.com, and YouTube, Spotify, and Apple Podcast. I will see you on the next Bloom Health Club.